I think we'll go ahead and get started so we can give Ali as much time as possible and then maybe have time to chat afterwards. We're honored for an incredibly busy person. Dr. Ali Saad completed the University of Colorado Climate Health Fellowship last year, and he stayed on now as affiliate faculty, but he still practices neurology, which was wonderful because he's board certified in neurology, stroke, and lifestyle medicine. And his advocacy work has focused on diet being the leading cause of death and disability worldwide and accounting for 1/3 of global greenhouse gas emissions. And that makes nutrition one of the most important issues at the intersection of human and planetary health. He's also chair of the neurology member interest group at the American College of Lifestyle Medicine. And what's super cool is that I'm not sure if we call you early or mid-career, somewhere in there, right? And he has some really hopeful things to say, even though most of us on this call are sort of gray and white hair, but some hope to how people can do this work when they are early and mid-career. So thank you very much, Ali. Ali.
All right, thank you so much, Lori. It's a pleasure to be here. I'm gonna try and share my screen. Let's see here. Are you able to see it with no notes, full screen? Okay, great. And actually, my colleagues in neurology and I just launched a website for our movement called Neurologists Interested in Climate and Health. It was put together by one of our core members of that group named Dr. Brett Andrews. And I can put that in the chat for you guys, but I'm trying to get neurology up to speed, and we're all trying to get neurology up to speed to where the rest of you are with your specialties. So I'll go ahead and get started. Go here. All right. All right, is the screen still up? You able to see it moving? Okay, good. All right, let me minimize this. All right, so these are my disclosures. And I want to briefly tell you my origin story before I get into the data. So by 2019, I'd been an attending for 5 years, and I felt like I wasn't really helping people because as a stroke doctor, I was providing these acute life-saving treatments in the hospital. But ultimately, I was sending people back into these environments where they were getting exposed to unhealthy food, smoking, air pollution, low physical activity, all of these social determinants of health that account for 90% of attributable stroke risk, pretty much the same factors that account for 90% of heart attack risk. So I became very interested in learning more about lifestyle's role in preventing stroke and chronic disease, totally unrelated to climate change. And I didn't feel like I was burnt out. I was kind of bored. And I also felt like my work was kind of futile. Separately, I'd always been interested in environmentalism, doing all the things that a typical citizen does, taking public transport, recycling, etc., but unrelated to medicine. And then I learned that the University of Colorado had this climate and health fellowship. I was mostly intellectually curious, and I thought at the very least it would be a fun and interesting thing to do for a year. But the fellowship really blew me away. And I didn't realize just how much health was tied, or our personal health was tied to that of the planet. And so climate medicine went from being this interest to a passion. And that's what I do with most of my time now. I see patients about 10 days a month, and the rest of the time I'm doing this. And so after I finished the fellowship, I had to decide how can I use my time most effectively? And I looked to the data for guidance. So, of course, the main driver for climate change is greenhouse gases, specifically in the energy sector. But if I want to help with climate change, by the numbers, fossil fuel divestment should be where most of my time is spent. But what avenues could I use to address the 73%? And so I started doing what most people in this audience are doing, writing review articles for medical journals, op-eds, starting sustainability committees at my hospital, giving public testimony in support of anti-pollution bills. And I continue to do this, but I realized there were a few problems with this kind of advocacy. Number one, return on investment. As a doctor, I have the most influence for divestment from fossil fuels, specifically within the healthcare sector, not the energy sector. And healthcare only accounts for 4.5% of global emissions and 8.5% of US emissions. The second issue is accessibility to the average doctor. Climate advocacy was something extra for me or any other doctor, or most doctors, I would say, who don't have it tied into their academic job, to do on top of their day job. it didn't have as much to do with direct patient care, even though pollution ultimately heavily influences social determinants of health. And for those that did have the time and passion to do this kind of work, as soon as they got busy in other areas of their lives, this sort of work went straight out the window because direct patient care comes first. And so it wasn't really accessible to the average doctor. The third issue was that I found a lot of doctors couldn't relate. There was only so much that I could do on my own, and I needed help. I couldn't get the average doctor on board to help me because they either didn't think this was in their lane or they didn't have the time. And I always had to explain the connection between climate and health because it wasn't obvious to a lot of people. And the fourth issue was power. I had to depend on people in positions of power to give the green light to change policies, like politicians, like hospital CEOs. And so although I knew by the numbers, fossil fuel divestment is the most important thing that needs to happen, it's being done by a very small minority of people like us with the time and passion to do this kind of work. And this doesn't mean that you or I should abandon this kind of traditional climate advocacy, but we need to get the average doctor or clinician on board in a way that benefits their patients more directly and synergizes with their patient-centered goals as doctors. And so I went back to the drawing board and I thought, what brings me joy? Well, I love to prevent problems before they happen, whether it's in my personal or professional life. In my field, stroke, that's done largely through lifestyle, the prevention, and diet is a big component of that. What am I good at? I'm good at creating co-benefits and mediating. I like to align values between people who seem to have goals that are disparate or at odds, and what work needs to be done. So from a health perspective, diet is the biggest modifiable risk factor for most chronic disease. And so then I thought, wait a minute, when I go back to this graph of emissions, food is the second biggest, largest sector. And it's the most important thing that needs to be addressed for human health when you take climate change out of the equation. So that's how I found my climate and health connection. And that's the connection I'm going to explain to you during this session. So here are three objectives. I'm going to start with how food systems impact climate change. Most of the direct emissions from agriculture come from livestock, specifically from ruminants like cattle and sheep. Ruminants ferment or ruminate their food to extract nutrients prior to digesting. And a byproduct of that anaerobic fermentation is methane or natural gas. And contrary to what the public thinks, most methane comes from cow burps and not cow farts. That's only a minority. And methane only lasts in the atmosphere for around 10 to 12 years, whereas CO2 lasts for hundreds or thousands of years. And the problem with methane is, of course, it's far more potent at trapping far more potent at trapping heat compared to CO2, about 30 times more potent. And so when it is in the atmosphere, it does more damage in that time that it's there. Whereas the CO2 we've produced over the last 100 years or so is still hanging around and continues to warm the Earth. But even though methane is such a huge problem, it's also a huge opportunity for climate action, because in a short time frame, in about a decade or so, we can dramatically reduce the harm from that methane by producing less of it, because it'll dissipate out of the atmosphere within a 10-year time frame. And here's a different way of slicing the data on global emissions. So again, most is not from food, but our food systems account for at least 26% of global emissions. And when you break that down into sectors within agriculture, the three colors that stand out the most in terms of leading the most to the most emissions are brown, green, and red. And all of these colors represent the inordinate land use we need to grow the animal feed and house for livestock and to house that livestock. And this is done by destroying forests, which are the planet's natural air filter, of course. And when you add up all these livestock emissions, they account for over 50% of the greenhouse gases produced within the agricultural sector specifically. And although food waste isn't the largest portion of our emissions, it's still a lot. If food waste were a country, it'd be the third most polluting country after China and the US. And when we include food waste in our agricultural emissions in that 26%, it now balloons to about 34% of global emissions. So that's a third of our emissions from our food. And just think of all the food we throw out in the hospitals. This could easily be given to patients, family, and staff at the end of the day for minimal or no cost. Climate smart policies, like charging hospitals for the trash they produce by weight, could incentivize food donation programs within hospitals. And the primary goal would be to address food insecurity, but it happens to have environmental co-benefits. Remember that most of the patients we see in the hospital are on Medicare and Medicaid, and these are the people most at risk for being food insecure and benefiting from such programs. But again, with climate co-benefits. This graph shows us the food supply chain. The blue bars are the carbon footprint at that stage in the supply chain, whereas the orange bars are the volume of food waste. You can see that the greatest volume of food waste happens at the beginning by overproducing grains and having it go bad before it's even used. However, most of the carbon footprint is at the consumption level in blue. It goes bad before we use it. So it'll go bad in supermarkets, at restaurants, or at home. And then we end up throwing it out, and it produces methane in landfills, which of course is much more potent than CO2 as a greenhouse gas. So of course, there's the direct air pollution from burning fossil fuels to supply the energy to grow our food. But we're also using up half of our habitable land on Earth to grow our food. We're depleting 70% of our fresh water to irrigate our crops and livestock. And we're also contributing to eutrophication. This happens when large volumes of manure, carcasses, and fertilizer get dumped by factory farms into rivers, and they become food for algae. Overgrowth of this algae depletes oxygen levels in the water, making it uninhabitable for marine animals and plants. And an example of this is the dead zone in the Gulf of Mexico. So aside from killing life directly in these bodies of water, the overgrowth of algae can also result in these toxic red tides, where certain species of algae, or not the algae, but the dinoflagellates that live among those algae produce neurotoxins that get concentrated in shellfish and become toxic to people who consume them. And these toxins, unfortunately, persist even when that food is heated or boiled or whatever. Heat doesn't destroy them, unfortunately, because it's the neurotoxins themselves, not the microorganisms that are causing the damage at that point. And so this is how what we eat impacts the planet. It's far more than the carbon math that we're all accustomed to dealing with. It touches so many sectors that affect our health and that of the planet. So let's zero in on meat consumption. Why do we eat so much of it? One of the reasons is that it's a marker of wealth. Here's an interesting trend of how meat production has changed from the 1960s to the 2020s in various parts of the world. Increased meat consumption tends to be a marker of a historically poor country becoming industrialized and increasing its standard of living. By the 1960s, North America and Europe had largely achieved a good standard of living for its average citizen. But look at how Asia's meat production has had a relative explosion in the last 30 years compared to other parts of the world. And meat consumption is just one marker of economic growth. Remember that 60% of the world's population lives in Asia. And as that population grows and its countries increase their standards of living closer to those of North America and Europe, that means that more production of greenhouse gases, and it means more use of resources. There's also Africa to consider, which has about 20% of the world's population. It hasn't even begun to have its boom that Asia has had, and it'll eventually be a big contributor down the road as well. So that's 80% of the population that has not reached its peak polluting power through meat and through other modalities as well. Here's a representation of how carbon-intensive red meat is relative to other foods. Generally, plants and smaller animals, which you see at the bottom of this graph, have the lowest greenhouse gas footprint. And this is because of basic thermodynamics. Smaller organisms generally need less time and less resources to reach maturity. So they're the most efficient organisms to consume and to replenish. And by the same logic, larger animals like cows require the most resources to grow to maturity and produce the most emissions in the process. But this is compounded by their production of methane, which other organisms don't produce as much. So you can see our top three most carbon-intensive foods are ruminant sources: beef, lamb, and dairy. So you might think, why not just eat local? Wouldn't that offset the emissions from importing meat? The answer is no. This graph has tiny print, but we're just focusing on the colors. The y-axis is a list of common foods, arranged from most emitting to least emitting, and the x-axis is the carbon footprint of those foods. And the breakdown of that carbon footprint is color-coded by areas in the supply chain represented in different colors. And you can see that the three colors you see the most of are green, brown, and orange. These represent, again, land use, like we saw earlier on that first graph. And that means that these emissions are going to be produced regardless of where that food is grown, local or abroad. And when you look at the blue, pink, yellow, and gray parts of the graph, you can barely see them for these individual foods because their carbon footprint is relatively minor. These represent food processing, transport, and packaging. The key point is land use and farming are the biggest contributors to emissions, and this is why a healthy diet with more plants is the most important thing we can do to change our food system. Interventions like reducing packaging, recycling, eating locally, eating organic have little impact on emissions relative to the damage caused by eating meat. So basically, imported beans are far more sustainable than local steak. And so what about when we compare meat to meat alternatives? And by meat alternatives, I don't mean impossible meat or beyond meat. I mean beans, lentils, and nuts, which are the plant kingdom's version of meat because they are relatively dense in protein and iron. This graph compares animal products to plants that are specifically protein rich. And again, it's clear that above this dotted orange line, things like beef, lamb produce the most greenhouse gases. But even when you look at things like eggs and fish, they produce anywhere from 3 to 10 times more greenhouse gases than plant sources of protein, like tofu, beans, peas, and nuts. Another advantage of these plant-based proteins is the range for greenhouse gas emissions is much narrower. You can see these really narrow bell curves at the bottom of the graph in green. So it's easier to make projections about these emissions. And you can see how narrow that these little green bell curves are compared to the top one in purple from beef. And the relationship between food and climate change is bidirectional. Not only are we worsening climate change with our food system, but as climate change worsens, it in turn threatens the security of our food systems. Natural disasters like wildfires and hurricanes destroy crops and the infrastructure needed to grow and distribute that food. These same disasters make it harder to access food that when roads are destroyed or when there's food scarcity, leading to export limitations. Most countries rely on importing some part of their diet from other countries. And lastly, aside from natural disasters, rising atmospheric CO2 concentration decreases the nutritional yield of crops, dropping the concentration of protein and key micronutrients like iron and zinc anywhere from 4 to 17%. Changes in ambient temperature also affect the distribution of pests, like invasive insects and microorganisms that can destroy these crops and threaten food security further. And people are already experiencing food insecurity from climate stressors. The issue is not that we don't have the ability to produce enough food and that we don't currently produce enough food. We do. We have enough food to feed the whole world several times over, as it is. The problems are that we're wasting a lot of it, and we're feeding most of it to livestock, which we in turn eat. We're producing food that's expensive, inefficient, damaging the environment, and making people sick. And our planet can't sustain the way we're currently eating. The picture on the right side of the screen shows some projections from 2050. If we continue to eat in the same manner, our food system will nearly double the amount of emissions it's currently producing, which of course is not sustainable. And so my first takeaway on optimizing our food consumption, number one, reducing food waste. And I want to offer some things that I do. So before I go do my grocery shopping, I check my pantry and fridge and plan my week's shopping and cooking around that. For any of you that have raised children, you know how much food gets wasted when you're trying new food with young children or when they're being picky. A lot of it gets thrown out because they don't like it. And this is especially challenging for people from low-income households. And the concern for picky eating is one of the reasons parents may not expose their children to new or potentially healthier foods. So one thing I do is I freeze leftovers and scraps that I wouldn't eat otherwise, and I blend them into smoothies, or I might add them to the dog's food, things like broccoli stems, carrot tops, extra herbs, things like that. They can also be pureed into baby food with a blender. And this has become a step I take before I toss things into the compost. And by doing that, I've reduced the amount I compost by about half. Another thing I do when I cook, If I end up cooking too much and I don't want to, save it for the next day, I share it with neighbors and friends. And now they do the same. And we have this nice community around the block. I made one of my neighbors some pistachio butter. I gifted it to her. And then the next day she came by with some curry that she made using the pistachio butter. And, now we all give each other bread loaves and, stuff. It's really fun. It's also saved me a lot of money between groceries, frozen meals, eating out. Me and my family and our 2 dogs, we spend about $1,100 a month on our food bill. So notice that all of these benefits of reducing food waste are not centered around the environment. These are all things that have direct benefit to us. The second key takeaway is to eat more plants and less animal products. Most importantly, less red meat and dairy, since they're the most greenhouse gas intensive foods that we have. And people often be hesitant about not getting enough nutrients when they're eating plants, especially when it comes to their children. So I like to show them direct nutritional comparisons from this free website I've linked at the bottom. A serving of tofu, for example, which is a type of bean or made from a type of bean, has more calcium than a tall glass of milk. Lentils have more iron than steak. And meat will always be more protein dense since it's muscle tissue, but lentils and beans are still very protein rich. And I want to give a quick note about tofu. Not all tofu is created equal. As you pull water out of tofu, it becomes more concentrated. This changes the texture and the way it cooks, but it also dramatically increases the protein content per serving. So this is soft or silken tofu, and you can see per serving, it's got about 5 grams of protein. But as you get firmer with your tofu, you go to here, firm tofu, now it jumps to 7 grams. Extra firm tofu, 8 grams. Super firm tofu, 15 grams. You can get a lot of protein from tofu, and you can dramatically change the texture just by trying different kinds. So just a plug for tofu. So next I'm going to discuss the health benefits of a plant-rich diet. So let's forget about climate change for a second. From a health perspective, poor diet has become the greatest modifiable risk factor for the majority of chronic disease. It's now surpassed smoking, and it's become a leading social determinant of health that should be a top public health priority. Here's data from the CDC. 6 in 10 of Americans, or 6 in 10 adults in America have at least one chronic disease, whereas 4 in 10 have at least 2. And when we see someone in our hospitals and clinic without at least one of these, they're certainly the exception to the rule. And we see these same trends globally, and that they're getting worse. This is a list of chronic diseases from the WHO, ordered by greatest to least mortality. The green diseases, and green lines, are the communicable or infectious diseases, while the blue ones are the lifestyle-related diseases, the non-communicable ones. And what we see here is we have these white dots in all of the lines, and they represent where mortality was in the year 2000, whereas the colored dots represent where mortality was in 2019. And you can see that all these non-communicable or lifestyle-related diseases are getting worse, whereas the communicable or infectious ones are getting less. And with the exception of chronic lung disease, they're all heavily, if not primarily, influenced by diet. So look at these: ischemic heart disease, stroke, Alzheimer's, diabetes, kidney disease, all heavily related to diet and other lifestyle risk factors, smoking, exercise, etc. And the US National Climate Assessment, which is a federally commissioned document, has recognized the connection that food has for both human and planetary health. It concluded that revamping our food systems is not only important for climate change, but necessary to address the bloated cost of treating chronic disease, which is mostly driven by the food people have available to them. It's much cheaper to prevent disease than treat it. So even though we should be changing our food system for our health, that's also essential we do it for our economy. So what's a healthy diet look like? This is from the American Heart Association, from their diet and lifestyle page. Broadly speaking, most of our food should be minimally processed, and a lot of it should be coming from plants. In fact, they now state, which I've highlighted in pink, that most of our protein should be coming from plants. And they say that if you, sorry, where was I? Yeah, mostly coming from plants. And so from a health perspective, the best evidence we have suggests that we don't need to be strict vegans or vegetarians, but we do need to be eating mostly plants. And so you can rest assured that if you are recommending a plant-rich diet, this is no longer fringe or an equally healthy option among many. It is now the mainstream dietary recommendation from the American Heart Association. And it's concordant with most dietary guidelines in several countries, including Canada, the UK, Australia, New Zealand, and Switzerland, to name a few. And there are clear climate co-benefits from encouraging healthy living. And this doesn't just mean eating more plants, but it also means taking active transports like walking or biking, as well as public transport over personal vehicles. This is important for people's health by reducing physical inactivity, but it also reduces greenhouse gas emissions and people's exposure to greenhouse gas emissions. This is an example of how a lot of the things we should be doing for our health happen to be the same things that are good for the planet. And we don't necessarily need to go out of the way or out of our way to do something extra for the planet. We should be doing these things for their direct health benefits. And so I like to think of lifestyle medicine as indirect climate medicine. We also see this inefficiency in our healthcare system. So again, 8.5% of emissions in the US from healthcare, 4.5% globally from healthcare, just from our operating in hospitals. We can install solar panels in the hospital, we can compost hospital food, we can get rid of plastic speculums, and we should be doing all those things, of course. But what's even better for patients in the environment? Keeping people out of the hospital so they don't need these carbon-intensive ICU stays, surgeries, medical devices, medications that drain their health spans and their wallets, because the greenest healthcare is the kind that never needed to happen in the first place. And when we use this framing, we don't need to convince doctors or our colleagues that climate change is real and in our lane. We can appeal to a universally shared value that our patients should be eating better and that it's a top public health priority. We can leverage existing mainstream non-environmental health movements, such as the American Heart Association's Food as Medicine initiative. So at the beginning of the talk, I stated that the energy sector is the biggest emitter of greenhouse gases on a global level, whereas food systems are the second biggest emitter. This is true. However, the order switches when we rank sectors based on individual action rather than systemic action. This table is from Project Drawdown. It ranks the impacts of various behaviors in terms of reducing emissions. The table has 3 columns. Starting from the left, we have a particular intervention. Then we have the sector that it's a part of. And then lastly, the gigatons of CO2 equivalents that would be reduced by implementation. And these are the top 10 most impactful interventions ranked from greatest to least. You have renewable energy like solar panels, wind in the middle and at the bottom of the list, but the top 3 are the health solutions and things that we should be doing for our patients irrespective of climate change. Number 1, making sure we're giving people food or giving food to people who need it and not wasting that food. Number 2, feeding people more plants without necessitating veganism or vegetarianism. And 3, making sure our patients are educated so they can be health literate. All actions well within our lane as clinicians. And you can see, or you can't see actually, but things like reducing non-food waste and recycling don't even register in the top 10. Not that we shouldn't be doing these things. It's just that they're not among the most impactful things when we examine them from a personal behavior standpoint. And eating more plants can be done in a way that's both palatable and translatable across cultures. This study, the Eat Lancet Commission, did the math to figure out how we can feed a projected global population of 10 billion without depleting our resources. And the conclusion they came to was this diet. They found that a maximum of 2 servings of animal products per day is acceptable for the average person to consume for a population of 10 billion, and it would be considered sustainable. And the way they broke this down by example is 1 serving of dairy and 1 serving of any other animal product, with the exception of red meat, because when red meat is consumed, they said it should only be consumed up to once a week because it's more greenhouse gas intensive than things like eggs and poultry and seafood. So an example of what a day of sustainable eating per this diet would be yogurt with some toast and fruit in the morning, a salad or a grain bowl for lunch, and then having chicken or fish, vegetables, and rice for dinner. This is not super restrictive. It allows for the consumption of far more animal products than people would think is permissible from a sustainability standpoint. And so, I mean, this is something that really surprised me. And I also don't want you to think that I hate on vegans. I'm actually an ethical vegan. And despite my bias, the conclusion I've come to from reviewing the data, and also in concordance with what our medical guidelines say, the healthiest diet for people and the healthiest diet for the planet is plant-rich. And even though, following the logic of that, veganism would be best for the planet, I'm going to show you some data in a little bit that shows that even just being plant-rich, we are already reaping many of the sustainability benefits. Here are some more reasons why dietary intervention is such a powerful tool for climate change. Food waste alone accounts for 3 times the global emissions from air travel. We tend to view flying as one of the cardinal sins of climate change, and that may be true for those of us who fly a ton, but on a global scale, not so much. Food is more impactful. And what I've highlighted here in the second section is what I think is the most sobering, but also very hopeful message that I've come across in the climate and health literature in the last 2 years. Even if fossil fuel emissions were eliminated immediately, food system emissions alone would jeopardize the achievement of the 1.5-degree target. That's the power of food. So combining this conclusion with the fact that poor nutrition is the single largest modifiable risk factor for human health outside of climate change, food is clearly the single strongest lever to optimize both human and planetary health. So let's compare emissions from how we're currently eating to how we could be eating. The x-axis is some various diets. So starting from left to right, we have our current US diet, what people typically eat. Next, we have the national dietary guidelines, what's recommended by the federal government that we should be eating. We have the Eat Lancet diet that I mentioned 2 slides ago. And then we have other diets, pescatarian, vegetarian, and vegan. And you can see in the y-axis, the carbon emissions from the components of those diets are color-coded. So like red for red meat, blue for dairy. That's what makes up the components of the carbon emissions for that diet. And anything above the black 0 line in the middle will produce carbon, and anything below the 0 line in green absorbs or sequesters carbon, meaning it's a carbon sink. So the first diet we see on the left is clearly all above the 0 line. It's very carbon producing, and you can see it's mostly driven by the red and blue colors. So that's red meat and dairy producing the most emissions. But even if we just follow the current federal national dietary guidelines, not even the Eat Lancet, not eliminating red meat, just reducing it will free up enough land that's used to grow crops for cattle to become wild land again and act as a carbon sink. And so when you look at the actual numbers, the national dietary guidelines would produce 600 million metric tons of carbon, but absorb 700 million metric tons of carbon. So it's slightly carbon negative. So this just means technically we only have to follow the national dietary guidelines to be sustainable. But in order to slow emissions down even further, we need to reduce our red meat intake a little bit more. Not necessarily eliminate it, just reduce it to no more than 1 serving a week, which is what the Eat Lancet recommends. And that'll result in the third bar graph, the Eat Lancet, where you can see there's a lot more green than the other colors. But a very interesting thing is when you compare the Eat Lancet bar to the pescatarian, vegetarian, or vegan, the gains made with sequestering carbon are minimal. And this is why, from a sustainability standpoint, a diet doesn't need to be strictly vegan or vegetarian. It just has to be plant-rich. And there's a lot of things we can call this. We can call it flexitarian. I heard this I forget the term, but there's a term in Korean that's trending now, and it translates to no chunk. And this way of eating means that there might be some animal products in whatever a person consumes, but not to the point that they can see visible chunks of meat or cheese in it. So they're just minimizing their animal product consumption. And so I also want to look at the mortality data related to diets. They mirror the emissions data. Again, here, we see different diets in the x-axis, but rather than carbon emissions, now we see mortality in the y-axis. And the first diet is our current diet. You can see that the bulk of our mortality can be attributed to red meat. And we can reduce dietary mortality in the world by substituting a big portion of that red chunk with legumes, which are represented in gray. So beans, lentils, and nuts, which are both healthier and a more sustainable source of protein. So with the Eat Lancet, not only are we reducing the red part of that bar graph, we are increasing the gray part of the bar graph, which is the topmost color on each bar. And again, the switch from Eat Lancet to another diet like vegetarian or vegan helps reduce mortality even further, but we can make the majority of our gains by simply cutting down to the recommended amount of animal products per the Eat Lancet diet. So dietary intervention is the climate advocacy that I feel is the most relevant to the everyday practice of clinical medicine, and which any doctor or clinician can get on board with. Because we can make this pitch to them that we should be feeding our patients healthier, and they don't necessarily have to believe in climate change or even care about it. If they just do what's right for patient health, planetary health will follow as a co-benefit. And look at how much land use would change if our diets were more plant-rich. By cutting down red meat, we are down to half of our current land use, just by eliminating red meat. If we cut out dairy too, we now eliminate 75% of our current land use. And even by continuing to eat seafood, eggs, and poultry, we've still freed up about 75% of our agricultural land. That's the size of North America and Brazil combined. And look at the relatively minuscule amount of land freed up from eliminating poultry, eggs, or fish, or even becoming fully vegan. So red meat and full-fat dairy consumed in excess are among the worst things for our health by being associated with vascular disease, metabolic syndrome, and several cancers, but also the worst things for our planet. So how do we communicate this kind of advocacy to colleagues, hospital executives, and lawmakers? It's much easier than you would think. As physicians, we're powerful and trusted communicators, and we need to use the same tools that we use at the bedside with our patients. We know what's good for our patients' health, but to move them to action, we need to frame an action using their own values. We do things like using motivational interviewing. We focus on common goals and values. We stay nonpartisan. Because most clinicians are not going to dedicate their careers to climate medicine. But the same actions that promote human health in terms of primordial risk factors and social determinants of health, which then result in the bulk of our chronic diseases, also promote planetary health. This is the dual benefit of food and the other components of lifestyle medicine. And one of the greatest lessons I've learned in climate medicine is that our beliefs don't have to be aligned as long as our actions are aligned. And I'm going to end with some food-related advocacy opportunities for those that are interested with some QR codes. So first and foremost, encourage patients to eat healthier. Use active or public transport. This is a nice infographic in the AHA that can be hung in your hospital ward or clinic with really easy to understand dietary tips that you can reinforce with your patients. Number two, Greener by Default. So this is a nonprofit. I recently joined their board of directors. They make plant-based food the default while giving diners the choice to opt into meat or dairy. And this strategy is health-focused, but has the co-benefits of allowing institutions to meet carbon reduction goals, save on food costs, and encourage inclusivity, all while preserving freedom of choice. And what I like about Greener by Default is they provide free informational and implementation consults. So you just scan the QR code and you say, hey, I want you to give my C-suite or my director in the cafeteria or my hospital CEO or whomever, I want you to give them free data on the finances of making a switch to a more plant-rich diet and the patient satisfaction scores. They can give you that. And they also help with free implementation consults for your hospital. And for those in positions of power in hospitals or medical schools, another nonprofit called Practice Green Health, they provide hospitals with resources to go green, including diet, but they help with a lot of things like how hospitals get their energy. And they do this by providing a online tool that will collect some benchmark data And based on meeting certain benchmarks, a hospital may receive public-facing awards of excellence. And over 1,500 hospitals nationwide have already joined Practice Green Health. And the American College of Lifestyle Medicine offers free food as medicine CME. So, learn about food as medicine. I think that it's about 5 free hours of CME in that QR code. And then there's also this tool that I like to use and I like to give to people who ask about the carbon footprint from their diet. So it's a nice interactive online tool where you can put in what you're eating, you make little adjustments and substitutions and reductions in your diet, and you can see the carbon offsets by making those small adjustments. And lastly, and I think most importantly, beyond your day job, we have to reclaim our positions as leaders in our communities. Over the last 50 years, doctors, nurses, dietitians, we are becoming less and less involved in terms of being stewards of our communities outside of our hospitals' walls. We are among the most educated, altruistic, and talented people in our communities. And we have a duty to ourselves, our families, and our patients to create enough time and enough space outside of our clinical work to leverage our power and promote health in areas that matter to us and affect social determinants of health. And that can be whatever you're passionate about: children, veterans, religious communities. They want to hear from doctors in their communities, and they want us to help lead. So I want to thank you for all the work that you're already doing for climate and health. And I hope I've left you with some inspiring ways to engage even more people for the benefit of our patients and our planet. Here's my contact info. Thanks for letting me speak to you all today. I can put in a PDF of my slides in the chat for those that are interested, and I'm happy to take any questions now for the rest of the hour. And I do mean any questions. None are offensive or silly or divisive. I'm very open to criticism, and I want to learn from you all.
That was extraordinary, Ali. Really extraordinary. First question before we forget to ask, do you mind sharing your slides or a PDF of your slides?
Yep, before I forget, let me put that in right now.
Or you can email it to me and I'll send them out to the people that are on the meeting.
I think it'll work. I just put it in. It should be 10 megabytes. It might take a sec. Let's give it a minute. All right.
And also, before we start asking questions,
okay.
John, please remind me of your last name. John on the phone, can you unmute?
Hello, can you hear me?
Yeah.
Oh, hi. I didn't know if you could comment on palm oil. It seems that there's a lot of derogatory statements about palm oil.
Oh, sure. So the question is, what's up with palm oil? Why it's a problem?
Correct.
It's like, okay. So yeah, the issue with palm oil is that it's produced in tropical environments, usually low to middle income nations, and it's produced by clearing rainforests. So just like how we will clear land to grow crops for our livestock or our corn or whatever, the same thing happens for palm oil. And palm oil, the reason it's so popular is because it is a saturated fat, meaning it's kind of solid at room temperature, similar to coconut fat or to cacao fat, the fat that makes our chocolate. And so it can be added to foods to help bind them together. And it can also be used in cosmetics. So it's just one of those things that is used in a lot of industries, including the food industry, but it's done in a manner that destroys our rainforests and our green spaces. And it's also not great for your health. So, the AHA recommends plant-based sources of fats, but they specifically say plant-based oils. So the unhealthy sources of plant-based fats are the saturated fats, so coconut, cacao fat, and palm oil, the solid and highly saturated fats.
I think Joanne was next.
Hi, Ali.
Hey,
that
Joanne,
was so great. Good to see you too.
Thanks.
That was amazing, and I have so many questions, but I'll pick one. I noticed in your early slide about meat consumption across various continents that North America is still going up, but Europe was the only one that was either flat or declining. And I wonder if we understand why that is? Are there cultural changes? Is it environmental consciousness? Is it something else? Because I think understanding that might help us know how to move the needle here in North America.
Yeah, I think a lot of it is conjecture. We don't really know, and it's probably multifactorial. So, in Europe, we'll look at certain European cuisines like French food, and we'll see like, oh, it's so fatty, and they'll have these rich beef dishes and chicken dishes. But the thing is, when you look at foods in countries like France, like, yes, they eat all these animal products, but they also eat a lot of vegetables and they eat a lot of grains, and they tend to have a more balanced diet. So, they are certainly not necessarily plant predominant, but they're at least plant rich, and they have a lot of plants in their diets. And not only are they eating plants, but the way in which they produce these animal products is also typically done with more care and more quality. And I think people are more concerned about the environment, and they have more public policies and more health policies that support healthier eating, and then healthier environments as well in Europe, whereas we don't really have these, I don't want to say restrictions, but people can often view them as restrictions in the US. It's kind of more do your own thing here. And unfortunately in the US, we get a lot of subsidization from the government for not only animal products, but cheap animal products, and also cheap processed food, plant or animal otherwise. So you think about food deserts, food deserts, I don't think of food deserts in America as somewhere where there's no food and no refrigeration. I think of them as places where people go to Walmart and CVS and gas stations to get their food. And there's certainly refrigeration where we could have frozen fruits and veggies that would be cheap. But usually these fridges and freezers are stocked with Jimmy John's and Haagen-Dazs, right? And a lot of processed non-perishables on our shelves, like Velveeta. So I think that's really the problem. It's, we have these food deserts, but the cheapest things that we can sell in these food deserts are the ones that are subsidized by our government. And we also have this conflict of interests in our government where the USDA serves the interests of food manufacturers, but they're also one of the major bodies that inform our dietary guidelines. So there's an inherent conflict of interest with what in the USDA's role.
Thank you, Nikhil.
Hey, Dr. Saad. First of all, thank you so much for the wonderful presentation. Very, very impressed and very passionate. I did want to ask you what, in terms of, carbon footprint, where does alcohol stand?
Oh, that's a great question. I haven't looked into that, actually. I really don't know.
No worries. And the reason
I should look that up.
The reason I'm asking is because, alcohol is so commonly consumed. I would feel like just with the resource intensive nature of growing the alcohol, whether it's grapes or whether it's barley, whatever, I just feel like that would also compound to the carbon footprint of our food choices.
No, that's a great question. And not only, from the direct production, of alcohol, but, aside from the morbidity and mortality produced by alcohol, there's also the carbon footprint from the fallout of alcohol in our healthcare system, right? Like how much end organ damage does that lead to, which necessitates ICU stays and procedures and surgeries, et cetera. That's a great question. I don't know if anyone's ever studied that. I should PubMed that, actually, alcohol and climate effects, or carbon footprint more specifically. Thanks for that.
David next, and then we have one on in the chat that can't talk.
Thanks so much, Howie. That was really informative. You covered a lot of information very efficiently. And I have a question kind of related to what you were talking about just a minute ago, the ultra processed food. And in the tables, we talked about meats a lot, but that didn't really fall out. I wonder if you think about ultra processed food, both from a health standpoint, which we know there's more and more information coming to showing ultra processed food is really, part of our health problem. But if you look at that as a category too for greenhouse gas emissions, I would think that would come up because of all goes into the processing, even though it's not meat. Most, I mean, there's jerky, but most of the stuff like you see at the convenience store or even the pharmacy is other stuff.
No, that's a great point. And it is also a environmental concern when we're talking about processed food. So, most of our processed food, we're talking about like cookies, crackers, cheap carbs. What are the sources for those? They're monocrops, right? Things like corn, things like wheat, things like soy, which are not inherently unhealthy. It's more when they're heavily processed and they become the main constituent of these really cheap snacks, then we're producing so much of these crops that we need to clear forests and rainforests to produce them, both in the US and abroad, not only to feed livestock, which is what they're mostly used for, but a lot of them are used to produce these garbage snacks that we eat. So not only is it bad for our health, it promotes monocropping, which is bad for the environment. It's bad for our soil health. I'm actually working on a paper with some people now about soil health. And I like to think of the soil as kind of like our gut. It's got a microbiome, just like our gut. And what happens when you have monocrops, you've got to till the soil. So you just turn up the soil and make it loose. And when you do that, you destroy the hyphae from fungi and you destroy the small roots from plants. And these are the microenvironments for healthy bacteria in the soil. And they also anchor the soil and keep it from getting washed away or blown away. And when you disrupt that microbiome and that architecture within the soil, it has so much harm for the climate, and it destroys that microbiome. And it's one of the reasons why we have to use pesticides for our crops, because now our plants don't really have a healthy immune system, and they're not colonized, or the soil isn't colonized by healthy bacteria and yeasts. And so unhealthy ones come and take their place. So thanks for that question.
Okay, you answered all the questions far too well. So Anna is up in the ante with a really difficult one. And she must be in a very traditional library because she can't talk. So she said, what approach do you believe would be the most effective in decreasing the influence of industrial livestock facilities on these subsidies? And
yeah, I think you really hit. Oh, sorry, go ahead.
No, go on.
No, so Anna, I think you really hit the nail on the head, because people have been eating animal products for thousands of years, right? Like this is what we've been eating for all of our lives. And it's not a problem. The problem is the amount in which we consume our animal products and the manner in which we produce them, right? And so the problem specifically is industrial agriculture and industrial animal agriculture, more specifically. And you're right. The reason that it is the way we get 99% of our meat from industrial agriculture is from subsidies. And so I think one of the most powerful tools we have in healthcare is we are not lawmakers. We can run for office, we can become lawmakers, but we control medical society guidelines, don't we? We produce publications, we make clinical trials. And when we have this data come out, this data is what informs medical society guidelines. And then medical society guidelines determine what is considered standard of care and what Medicare and Medicaid will pay for and will influence public policy. So I think our most powerful thing we can do to reduce subsidies is to publish more on the health harms from ultra-processed food, from diets that are heavy in animal products. And it'll be a very data-driven approach, and it's something that we can do that's well within our lane. But that's just one way. Another thing is really just talking to our patients about diet. Think about when you see someone with some kind of chronic disease. Often they'll go home and their spouse, one of the first things they'll ask them is, what did the doctor say about your diet? And often that answer, because we don't have the time or the knowledge, is, oh, they didn't say anything, or they just said eat healthy. But there's no next step, like how do you eat healthy? What is your specific barrier? And when we don't bring up diet, even 30 seconds, just give someone a little dietary tip when you're seeing them. If you don't bring up diet, you are sending a message that it is not that important to discuss, because you didn't make the 30 seconds of time to discuss that. And when we're feeding our patients unhealthy food in the hospital or making that easily accessible, we're also sending a message that, yeah, you should eat healthy, but it's not that big a deal that you're here with an MI and you're getting spaghetti and meatballs. You know, that's something for you to think about when you get home. So I think these little nudges and this unspoken message we're giving people is very powerful, and that needs to change. And that comes back to, what are we teaching in medical school? What is in our continuing medical education? What's in our board certification? If it's not being taught to doctors and it's not part of a certification process, they're probably not going to learn it unless they make the effort to learn it on their own because they have a particular personal interest.
Okay, Larry's been waiting patiently. He's our one other neurologist on the health team.
Hey, Larry. So
Hey.
actually, Larry is one of our core members, a neurologist interested in climate and health. The website I shared with you guys. Good to see you, Larry.
Excellent talk, Ali. So one thing I don't think you mentioned is the methane problem, release of methane by ruminants, cows, and sheep, which is a substantial contributor to climate change. Isn't that also an important incentive for people to get off beef in particular?
So actually, Larry, that's one of the things I brought up in one of my first slides. Let me bring it back up for you.
I got here a little late, so I missed that. I apologize.
Oh, no worries. No, it's okay. But I will. Actually, I put the PDF in the chat. So if you pull it up, there's some slides about methane, and we definitely covered that. But thanks for bringing that up. Methane
Good.
is one of our key contributors for sure.
Thank you.
Well, I want to ask a question that's totally unrelated to your talk, and it's based on the fact that you're a researcher. And I would like to know, when somebody asked you, how you phrase it with the associations or the links, the correlations, whatever, with dementia and Alzheimer's and air pollution. How do you word that?
How do I word incorporating
I
pollution
mean, tell
into?
people there's an association. Yeah. How do you?
Oh, okay. Yeah. So I don't bring up climate change per se with patients because I don't want them to think that I'm there as, a climate advocate. I'm there to treat them. I'm there for their health, right? I'm there as their doctor. But what I will bring up is climate sensitive hazards that affect their health. So things like air pollution, things like heat waves. And so if it's relevant, if someone has Alzheimer's, then or they have stroke, I'm seeing them for stroke, I will bring up things like air pollution. I'll say, hey, this is actually one of the risk factors, modifiable risk factors for cognitive impairment, which a lot of it is due to small infarcts, actually, to vascular dementia. So I do bring it up, and I also bring it up with doctors, and I cite some mainstream literature. So my colleagues and I gave a talk at the American Academy of Neurology's annual meeting last week in Denver on climate change and brain health. And I did bring up this one graphic from a 2020 study in the Lancet, and they attributed at least a 2% risk for Alzheimer's disease and related dementias from air pollution. And another graphic I cited was from the World Stroke Organization, and they attribute, shockingly, 20% attributable risk air pollution for global stroke burden. That's a huge number. And I think the reason that number is so high is because most of the global stroke burden is from low to middle income countries who are disproportionately impacted by air pollution. They tend to have dirtier air, and therefore there's a larger attributable risk. But the attributable risk of air pollution for stroke in the US is also highly variable based on zip code. And a great resource to find the relative exposure of various air pollutants and get air quality grades for counties in the US is the American Lung Association's website. You can just put in your state or your zip code, and it shows you air quality grades. And that's actually a really effective tool when I'm speaking to some lawmakers, particularly more conservative lawmakers. I don't talk about climate change. I say, hey, did you know that poor air quality is a risk factor for a lot of people who are your constituents? And I go to the ALA's website and I show them in your state, or sorry, in not only in your state, but in your county, I can tell you how many people over the age of 65 exist, how many people with asthma exist, how many children exist, how many people with ischemic heart disease exist. And these people are all particularly vulnerable to air pollution. And we need to have cleaner air for our patients so that they don't get sick. And I don't even bring up climate change. I make it health centric.
Thanks. It's past 7:30. If Ali can stay on a few more minutes, we'll try and answer the other two. I'm sorry, I didn't see your hand up, Shweta, when I asked him a question.
Oh, sure.
But people who need to go, feel free to. This is just absolutely fantastic, though. So can you stay?
Yeah. I just have like just a quick comment to make. I don't have a question. I loved your presentation. I just wanted to share my personal story that growing up, I was a vegetarian. Then I moved here, I got pregnant, and you go to the doctor and say, not getting enough protein, you have to be careful by your diet. And then I'm like, okay, I need to get protein. I speak with my family and friends, and they're all like, yeah, I think this is the time, and got brainwashed. And for next 10 years, they started eating meat, and then got into the environmental movement. And then growing up, when I was a vegetarian, I never had a good reason apart from like just, compassion for animals, but never had a really good reasoning for turning a vegetarian. But when I really, became more aware of the climate and health impact, that's when I switched back to vegetarianism, and now I'm a vegetarian. But one of my children now switched to vegetarianism. But I feel it's also very cultural. It's such a cultural thing that if you're born and raised eating something, and your grandmother has been cooking something, you just don't know how to break out of it. It's such a cultural thing. But when your physician tells you to break that habit because of some reason, it's so much more. Yeah, as a physician, you have so much power to really shift that conversation. Otherwise, it's just a really hard pattern to break. So I just wanted to make that comment of how I shifted from, my food choices. But really, really impressive talk, and I think you covered a lot of great points in there, and just talking about all these different benefits, and not even touching on climate. It just makes sense so much. So thank you for your talk.
No, thank you for your comment. And I think I've seen this happens a lot. If people get pregnant, or they have children, or even they get puppies, they're worried about, oh, it's not about me anymore. I have to keep this other person alive, and I'm responsible for them, right? And so I think a lot of physicians just don't know, right? And there's this paranoia that's not really based on any data that, oh, like this person's pregnant, they need more protein. Where do you think the animals get their protein? They're from plants, right? And so we're trying to work with organizations like the American Heart Association to educate specialties about, that not that people have to be vegan or vegetarian, but that it's a healthy and suitable options for all age groups. And in fact, I don't want to misquote, but I forget which society. I think it's the UK's equivalent of, their National Pediatric Association. But I think they're the ones that put out a guideline saying that having a vegetarian diet is nutritionally adequate when, designed properly. And I think, people always bring up that caveat. It's like, well, it's only if it's designed properly by a dietitian, because they could get malnutrition or not get adequate nutrients. Like, if you're not eating enough plants, you are deficient in fiber, you're deficient in potassium, you're already deficient in other micronutrients. So it's not that one diet is better than the other. We need a diverse diet that covers all of our micronutrients, and we can be very unhealthy and be nutrient deficient in all sorts of diets.
Very good. Okay, last question. Catherine Card, who does neurology research, I think is how you describe it.
Yeah, and my question was relevant to that. I'm also the daughter of a mom who died of Alzheimer's. And although I'm completely on board with the effect of air pollution and diet affecting cardiovascular illness, including stroke, particularly with air pollution, your mention of Alzheimer's, and this was the first that I'd heard any mention of Alzheimer's being related or being shown to be that diet or type of diet affects Alzheimer's. Could you say a little bit more about that, or particularly of air pollution affecting Alzheimer's risk?
Yeah. So the way air pollution affects our health, it's predominantly through inflammation. A lot of our diseases are related to inflammation, and air pollution is just one of those things that exacerbates inflammation. And it can happen in your lungs and lead to asthma. It can happen in the blood vessels in your heart, leading to heart disease. It can happen in the blood vessels in your head and neck, leading to brain damage. And a lot of the brain health literature we have related to air pollution is kind of borrowed from cardiovascular literature, because a lot of dementia is partially attributable to tiny strokes that people have accumulated over the years. So people will often be labeled as Alzheimer's without an actual diagnosis based on autopsy. A lot of people who have dementia will have a little bit of Alzheimer's. They'll also have a bit of vascular dementia, which is basically the accumulation of tiny strokes over the years. So that's how diet and pollution is a risk factor for dementia, or one of the ways.
So are you?
But there.
So, go ahead. Go ahead.
No, please. What did you want to ask?
You saying that there's a correlation or a relationship between transient ischemic attacks and, well, that would be with strokes, but transient ischemic attacks and Alzheimer's?
Oh, transient ischemic attacks are, yeah, transient ischemic attacks, I really think they're a terrible name. People think, they'll call them mini strokes, but they're essentially strokes that are very small, and the symptoms went away. And often we'll see people who've had a TIA, and then look, and we get an MRI and there's no stroke on there. Then they come to the clinic and they say, well, ever since I had this TIA, I've been feeling really tired, or my thinking is kind of foggy. And then we get a higher definition MRI that we may use mostly for research purposes, then we can see the stroke. So often with TIAs, the damage is just too small for us to appreciate on an MRI, but they're really just small strokes. They happen largely the same ways, and we treat them with the same level of concern that we treat strokes, because it just means that someone got lucky and they didn't have a huge stroke.
And those TIAs have been shown to be related to Alzheimer's risk?
Not TIA specifically, but we know that stroke and dementia do go hand in hand. When you have risk for one, you usually have risk for the other, because the mechanisms, although they're not identical, there are a lot of the shared mechanisms.
Interesting. Thank you very much. That is interesting. Thank you.
Of course.
Well, this was absolutely fascinating. So the good and the bad is that it's so good that a lot of people are going to be asking you to talk to other groups. So we really appreciate it. This was very, very good. And I think Ali could probably do another session on what he did with his climate fellowship and talking about early and mid-career physicians and all kinds of things. But this was just absolutely fantastic. So thank you very, very much.
Yeah.
So much.
Thanks so much.
Thanks, everybody.
Thanks very much.
Have a good rest of the night.
You too.
Bye.